Every Way Woman presents Life After Breast Cancer.
Welcome to Every Way Woman. We're talking all things breast cancer and what it means to be a survivor. We have two doctors from BreastLink with us today, Dr. Kapoor and Dr. West, as well as survivor Sherry Kinnison. Do you consider yourself a survivor?
Of course, I'm a survivor. I think you're a survivor at anything in life. And once you come through breast cancer, you just up the ante. And not only do you survive, and we really try to let women know they're going to thrive if you'll let your mind go there.
Some women don't like the term survivor.
Well, you know what? If they would just accept it, it makes you stronger. It makes you stronger in whatever you're going to do in life. Women survive having babies. You survive having a divorce. And to me, this is a real challenge, and you are a true survivor when you go through breast cancer.
The women that I know in my life that are survivors, they also use the word thriver. And I say, well, why? And it's because not only do we survive something, but we're thriving on a daily basis to let this cancer know that you're not going to get the best of me. I can imagine you feel like that as well.
Yes. We started a calendar for BreastLink a few years back, and that is one of our themes. Not only will you survive, but you will thrive.
So let's rewind to your experience, your personal story with BreastLink. Could you share that with us?
Yes, I was diagnosed. My gynecologist, I went to get my mammogram, and I did miss a year, which ladies do not miss a year of getting your mammogram.
Thank you for saying that.
I missed a year, and I went for the mammogram that year, and my gynecologist called and said, you have breast cancer, and I want you to go to a surgeon. And I went to one that he uses, and I walked out of there and said, I won't come back.
Why?
And it happened to be a woman. She was just very cold, didn't bring any of my images in to go through with me, nothing. Walked in and said, I looked at your images, and I will schedule you for surgery on Friday, and then we'll see what we're going to deal with.
Did you know anything about breast cancer prior to her just dropping that news on you?
Nothing.
Amazing.
But your experience with BreastLink was quite different. I mean, you did go in there kicking and screaming, so I've heard.
Well, luckily my doctor, your general practitioner, knew Dr. West, and he said, and he lives out by us, and he said, if my wife got breast cancer, there's only one place and one doctor that I would send you to. And he said, I will make a call in the morning and we'll take care of this. And at that time, I had so much fear because of what had just happened to me. And Dr. West, 9 o'clock the next morning, I get a phone call. Good morning, this is Dr. West. I said, yes.
You work with survivors, and are there hierarchy or different levels of survivors? And what I mean is, maybe I didn't lose my breath, but you lost your breath. Do sometimes patients feel, well, I endured more than you did? Do you ever encounter that?
I really don't. I think that once you become any part of it, you become a champion together. Absolutely. And the women, no matter what they go through, if it's smaller than the others or greater, I think they all bind together more as just a unity and a family. And, it doesn't matter. You just want to get the word out there that, you know what, if you catch it in time, you're not going to have to endure what I had to endure.
Let's talk about the pre and kind of post mentality of a survivor from the doctor's perspective. What is the difference in that?
I mean, our patients are our heroes, really. What they go through, what their families endure, they're all thriving, and they're all my personal heroes.
But what about the ones who are struggling? Because I'm sure there aren't all positive soldiers in there.
It's our role. It's our role to take it on and make them. Give them that strength and that energy and that team approach to helping them get through it. If they don't have a support group, we try to be their support group for them. Dr. West is
he did a wonderful job with
the founder.
Right. I mean, he would call me and say, okay, have you made any decisions? And I'd say, no, Dr. West, I just can't wrap my brain around this. I just really don't think I want to do this. And he said, well, I don't think we have a choice. And it was just his nodding and pushing and caring.
So really, he has the mentality of a survivor, because in that you have to have that, that motivation.
It's part and parcel, Dr. Kapoor said. I mean, you have to kind of go in their shoes. You have to look at it and understand what they're going through. And sometimes it's very stressful. The patients can, be very challenging to deal with. You must be patient. You must listen to them because they will give you verbal clues of what's going on. And if you take the time and listen and pick up on these subtleties, you can walk them through with much less stress, get them to a final decision.
She went from kicking and screaming to now she holds people's hands in surgery. I mean, that's a wonderful example of what's going on.
There's so many things you have to survive. It's not just the cancer. It's maybe changing your jobs, telling your family, your kids,
relationships.
Your relationships. There's a lot to survive through the treatment course.
Sherry had a very supportive husband. We talked about that previously. It makes a big difference. Not everybody has a significant other. And our volunteers, in a large extent, will step in and they'll go to their house on the weekend. They'll call them at night. They'll bring them to the support programs. And we have extra professional help that's on staff, the people that really need the support. But you really have to listen and be there and walk them through that process. And it's extraordinarily rewarding. Nothing makes you feel better than to see a survivor, which she
we'll have
is,
more survivor stories
and
when
a
we come
thriver,
back.
which she is.
More Every Way Woman. Stay tuned.